my name is Juan. I'll be your nurse for today. How are you?
Good.
Can I just have your name and date of birth?
It's Denise Santinello, 82974.
Great. Can I just check your band just to make sure? Wonderful. Wonderful. And what are you here for today?
Just a physical.
Just a physical? Okay. Any cultural beliefs?
No.
I should be worried about. And what is your preferred language?
English.
Great. And per that assessment, I assessed that the patient is just appropriate for the weather. Hygiene is good. Anxiety level is normal. No involuntary movements noted. And that's it. And I'm sorry. I just have a couple questions to ask you.
Sure.
Who was the current president?
Trump.
And what year is it?
2018.
And what's the country above the United States?
Canada.
Okay, great. And now I'm gonna move on to checking your cranial nerves. First things first. I'm gonna check for your eyes. I just have a couple questions. Do you have any redness or swelling?
No.
Any type of itching? Or
No.
I'm sorry. The better question is, do you wear any contacts or glasses?
No.
No. Okay. All right. So what I'm gonna do is I'm gonna check for Perla. Okay. Just gonna check if your eyes are okay. Wonderful. And I'm just gonna have you follow this. Okay. And I'm just gonna make a letter for you. Okay. And I just need you to follow it. Okay, and can you do this for me? And great. Let go. And I'm gonna take my cotton ball, and I'm just gonna check for. Keep them open. Okay, and then can you also raise your eyebrows for me? Wonderful. All right. Second thing I'm gonna check are your ears. Question for you. Any tingling or
No.
any irritating thing going on?
No.
No. Okay. And do you have a hearing aid?
No.
No. Great. So what I'm gonna do is I'm gonna have you cover one ear, and I'm gonna whisper something, and I need you to repeat it. Okay?
1, 2, 3.
And the other ear?
2, 3, 4.
Wonderful. Okay. And third thing I'm gonna check is your nose.
Okay.
Okay. I'm just gonna check underneath. Okay. And I'm gonna have you cover one nostril and take a nice deep breath for me. And the other nose. Wonderful. Now with the nose, do you have any type of nosebleed?
No.
And nothing irritating going on
No.
in the nose? Wonderful. And the fourth thing I'm going to check for you is your mouth. Can you just say ah for me? Okay. Can you say ah? Can you give me a bigger ah? Wonderful. And can I have you say ah and move your tongue? Wonderful. And just a couple of questions. Do you have any trouble swallowing?
No.
And no irritating factor here?
No.
In the throat area? Great. So couple more things. Can I have you shrug your shoulders? And can I have you puff out your cheeks? Wonderful. So with that I assess cranial nerves 2 through 12. Her eyes. Her sclera is white. Her conjunctiva is pink. And I assess for Perla, and pupils are equally rounded and symmetrical. For her ears are bilaterally symmetrical. No drainage, no fluid or drainage noted. For her nose, both her nostrils are symmetrical, and no signs of exudate. For her mouth, I assess her teeth are white. Her teeth are white. Her mucosa is pink and moist. Okay. So moving on, Denise. I'm gonna be listening to your heart sounds, okay? Okay. Just a couple of questions. Do you have any type of chest pain?
No.
Do you sweat easily?
No.
No? Okay, great. So what I'm gonna do is I'm gonna be listening to some landmarks in your heart, okay?
Yep.
Alright. I'm gonna listen for your aortic, pulmonic, Erb's point, tricuspid, mitral, and apical pulse. I'm listening for a whole minute. Okay. Now, same thing, but I'm gonna use the other side of the bell, okay? Now this I'm checking for murmurs. I'm listening for apical, pulmonic, Erb's point, tricuspid, and mitral. Okay. All right. So I've assessed her heart sounds. No murmurs noted. No adventition sounds noted. I listen for a whole minute for her aortic, and her normal, and I listen for her S1 and S2, and I also and her breathing is, and her pulses are greater than 75. Okay. All right, Denise. I'm moving on to your lungs. Just a couple questions. Do you have any shortness of breath?
No.
Do you have any trouble walking up and down the steps?
No.
Okay. So now, just a couple tests. I'm gonna place my stethoscope in the front and the back of you. Okay. So
Yep.
just give me nice deep breaths. And now I want you to say 99.
99. 99. 99. 99.
And now I want you to say E.
E. E. E. E.
And now I want you to say 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
And one last thing. I'm just gonna put my palm, okay? Say 99.
99.
Okay. Same thing. I'm gonna go in the back, okay? Give me nice deep breaths. Okay. Same thing. 99.
99. 99. 99. 99. 99. 99.
And E.
E. E. E. E. E. E.
And 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
And I'm gonna put my palms again. 99.
99. 99. 99.
And I'm gonna need you to take a nice deep breath for me. Wonderful. Okay. With that, I assess her normal her breath sounds. I assess for normal sounds, and adventitious sounds. She is negative for bronchophony, egophony, and whispered pectoriloquy. She is positive for diaphragmatic expansion. She is normal for diaphragmatic expansion. And now I'm gonna look at your pulses, okay? Can you just tilt your head for me? Okay. The other one? Can you just do this for me? This is I'm checking for your radial pulse. I'm sorry, brachial pulse. radial pulse. Can you just split your legs? This is her popliteal, posterior tibialis, and pedal pulse. Okay. And then can I also check your nail beds? Okay. Toes. Okay. All right. So now I'm gonna check for your skin. Check for your skin. Just a couple of questions. Do you have? Can you just do this for me? Do you have you had any rashes or
No.
anything in the past week?
No.
Do you? Are you Is are your vaccinations on Are your vaccinations on point?
Yes.
Are they updated?
Yes.
Great. With that assessment, I've assessed for her skin. Her skin is cool and dry to touch. I noticed no clubbing of the fingernails. Can you just put your legs again? I'm gonna check for some edema, okay?
Mm-hmm.
And with that, no edema on the extremities. Now, can I just have you lie down on this bed? I'm just gonna be listening to your tummy, okay?
Yep.
Ready?
Mm-hmm.
Wonderful. And now I'm just gonna check for some tenderness, okay?
Mm-hmm.
Tell me if it hurts.
No. No. No.
Wonderful. And with that assessment, I assess for her belly. There is no tenderness noted. I was not able to palpate. I was not able to palpate her bladder, and her stomach is not distended. Okay. Just one last thing to check. I'm just gonna check for some muscular movements. Okay.
Mm-hmm.
With your stomach though, any diarrhea?
No.
Any diarrhea? Any type of constipation going on?
No.
Okay, great. So now I'm gonna check for your muscle movements. Do you have any problem walking?
No.
Any type of muscle spasms going on?
No.
No. Okay, great. So what I'm gonna do is I'm gonna have you flex. I'm gonna have you. No, press the brake, and up. Great. And I'm gonna do the same thing, but I'm gonna apply some resistance. Okay, so press the brake, and up. Okay. Now lift your knees. No, just one knee. Go that way, and go this way. Same thing. I'm gonna apply for resistance. Go that way, and go this way. All right. Other side. Go that way. Let's do it again. No.
Oh.
Go that. No, right here.
Oh.
Now go that way, and go this way. Okay. Okay. Can I just have you lie up? Okay. Do this. And do this. Okay. And can I just have you face this way? And I'm just gonna check. Scoliosis, lordosis, kyphosis. No. Okay. With that, I assess for muscle, for range of movement. For range of movement, I assess patient. Patient is erect. Patient's posture is erect. No signs of scoliosis, kyphosis, and lordosis. And one last thing I just remembered to do. I'm gonna have you do this. Okay. So we're gonna be doing this. Apply some resistance. And this. So can you do this for me again? And this. Wonderful. Wonderful. And with that, that also comes part of the musculoskeletal system. And that concludes our assessment of Miss Denise Santinello.